Practicing medicine's a weird one because sometimes we have to have conversations with patients where we want them to stop doing something that is objectively working for them because it's not doing what they think it's doing for them. Good example with sleep is that often you'll find that people will have a small amount of alcohol, glass of whiskey or whatever to help them sleep. And as far as they are concerned, it absolutely does. But from a medical perspective, I know that's not helping. See, alcohol is a sedative. It knocks that person out, so it gets them to sleep. However, it impacts on the quality of the sleep that they're getting. And more important than that, the sedative effect of alcohol, as it wears off in the night, might even result in them waking up. Now, it might be a very low-level arousal. They might not be aware that they've actually woken up, but it will have happened, and that will have impacted on the restorative level that they're not getting that night. So I have that very difficult discussion of, I know this thing that you're doing helps get you to sleep, but actually it might be one of the things that's contributing to the poor quality sleep. And there's no easy way to get through that other than to stop it and deal with that distress and discomfort of thinking, well, hold on, I'm not taking the thing that I know that will get me to sleep because somebody's told me it's going to cause me harm. And that's where building a therapeutic alliance with a patient is very, very important. Sometimes we're able to use the drug to help a patient, but sometimes it's using simply therapeutic knowledge. And stopping alcohol before sleep is definitely one of those things where it's a case of trusting in the process. A little bit like trusting to go to the gym. It's painful going there, but over time you will see those results. And that's sometimes very, very difficult for patients to accept. But we do always get a benefit with those things. And it's about, with the sleep cycle, steadily chipping away at all of the things that might have a negative impact to give an overall benefit at the end. For myself, a good example there is caffeine. If I have caffeine closer than 12 hours before I go to sleep, that's going to have a huge impact on my night's sleep and make tomorrow even worse, which is a problem when I'm having to rely on caffeine to get through the day because I've got bad sleep as it stands. So think about what you might be doing that you think on the one hand is helping, but could actually be causing problems down the line for you. Sleep's a fascinating subject. So if you're having difficulty with sleep, have a chat to your GP and let's see what we can do.